Hey, I can hear you. And everybody can hear me okay? Okay. I'm going to do this hands-free. Okay. You got the first slide up? Okay. So thanks everyone for your help and letting me stream into your meeting. I wish I could be there in person, but I'm not allowed at this time, but maybe in the future. I've worked with Vi and Pam in the past and really really take these issues to heart, especially in these vulnerable communities where we don't have a lot of our outreach efforts. And we wish we could be there. And although we can't, we are definitely going to be here to help. So go to the next slide. So this is our slide about why environment matters. I don't have to preach to the choir here, but it helps us that we have data to support why environment matters. We know that 13 million deaths can be prevented by improving our environment. We know that environmental factors influence 85 out of 110 non-communicable diseases, and this was in the WHO report. This really helped raise the visibility of our efforts, along with EPA, that the environment is really important to consider when developing prevention programs. And we know that environmental factors account for at least 2/3 of the cases in the United States alone. So as Linda likes to say, you can't change your genes, but you can change your environment. Next slide. So issues of why children are important to us, but they're not as healthy as they used to be. So we know that 1 in 6 children in the US have a developmental disability. And we know this has actually significantly grown in the past decade by about 17%. And that 14% of our children are under the age of 18 have been diagnosed with asthma. And that 32% of our children are considered overweight or obese in the last assessment at 2010. And nearly half of our children now are allergic to something. And I think we all as parents can relate to that. So next slide. Lots of data on what moms are exposed to. We have the body burden showing that there's over 287 chemicals found in our cord bloods, that 47 chemicals are present in every pregnant woman tested, that our breast milk is contaminated. And of all the people that the CDC tests within the NHANES assessment, all of them have presence of BPA, phthalates, triclosan, PCBs, as well as these airborne contaminants from also known as polyaromatic hydrocarbons. Next slide. So what's the significance of the cohorts that we've been building at NIHS and EPA, and what do they help us really address in children's health? Well, by understanding the effects of these exposures on children's health, it's one of our biggest priorities. Following the populations over time helps us understand not only the individual effects, but the synergistic effects and of these environmental exposures on pediatric outcomes like birth outcomes, respiratory outcomes, neurological, and now we're looking at metabolic outcomes in these children. Next slide, please. Now, since Nika gave you a wonderful overview of the children's centers, brief but good, I'm going to just show you where our strategic plan sits and the mission of our institute and how children's health fits in that. So the mission is to discover how the environment affects people in order to promote healthier and happier lives. We have these mission boundaries of community engagement, training and education, our fundamental research, our exposure science and translation. And children's health falls into this goal too, which touches upon individual susceptibility across the lifespan. And next slide, please. One of the flagship programs that was developed in another collaboration similar to the EPA collaboration, the Children's Centers, is BSERP. And this BSERP characterization is really looking at where the Children's Centers is focusing on the prenatal and childhood. This was focusing on the early adulthood, early childhood transition to puberty. And the characteristic of it was really to look at environmental exposures across this window of childhood, early adulthood, and premenopause, to look at what are these environmental exposures that may be linking us to breast cancer specifically. And we kind of back the window of exposure up to look at pubertal development. And what are those environmental factors that could be contributing to early puberty? Because as we know, early puberty is related to is an early risk factor for breast cancer. Next slide, please. So in this collaboration, the BCERP collaboration, we found many interesting insights into the onset of breast development in younger girls was related and strongly related to BMI. We found out that high molecular weight phthalates were associated with pubertal development, as well as our retardants and our other persistent organic pollutants were associated with changes in breast and pubic hair development. And really what this was suggesting is there were things that were delaying puberty, there were things that were accelerating puberty depending on the populations we were studying, so that we knew that environment was having an impact here. And we decided that within this program, like the children's centers, we really developed meaningful messages that were needed for kids because we wanted to start really early, working with the mothers and the young daughters who really wanted the messages about what the scientific detail was about, but they wanted us to present it in a more readily friendly format that included really explicit details about the explanation of the findings. Next slide, please. And in the same kind of program, like the children's centers, like the BCERP, NIH and EPA developed the Centers for Excellence on Environmental Health Disparities Research. Next slide, please. The program goals of this were really to look at the mixture of basic and applied research, develop capacity to expand the stakeholders' participation in the research, and develop methods to integrate multiple factors, both those chemical and non-chemical stressors, to look at environmental health disparities. And another core aspect of this program is to disseminate the knowledge that's culturally appropriate and that will benefit affected communities. Again, we were hearing from our stakeholders that this translation of the message needed to be appropriate. Next slide, please. This is just a quick slide of who we funded, and two of them have a focus in children's environmental health, and that's Frank Gillen at USC, as well as Johnny Lewis at New Mexico. And these programs, although new, are really a nice program to kind of demonstrate how NIH and EPA have built these collaborative efforts to really address some of our vulnerable populations. Next slide, please. The next one I'd like to share with you is the CHEER program. Now, this just started at NIHS last year, and it is open for applications. It is an established laboratory analysis program for environmental exposures, as well as data analysis consultation at no charge to investigators. There's an application process where you go online, and if you have a cohort that hasn't had environmental exposures added to it, we look at your application, make sure that you have the right approvals in place and you're asking the right question, and we're providing that analysis for you. Next page. This gives you a quick, brief summary on the left of everybody who's funded as a lab, the targeted and suspected analysis of what we think the communities will be asking us to analyze for them, from metals to PAHs, all the way down to flame retardants, hormone panels, and nutritional factors if needed. This will provide access to state-of-the-art infrastructure for analysis of all biological samples, as well as understanding the biological response associated with those exposures. These labs are conducting targeted and untargeted analysis, and also will do the data analysis for you as well. Next. So in order to really start creating an opportunity for collaboration, NIEHS created a catalog of all of its funded epidemiology studies. This is going to give a really nice internal and external picture of what we fund, who we fund, and also this database will help folks understand the science we fund and also where there could be potential collaborations. Next, please. So facilitating the collaborations, it maximizes our investment, and it really does provide the junior investigators and new researchers to a path to find and initiate ancillary studies. Next. It has a phased approach. Right now, it's a fixed searchable table, and it just shows a snapshot of the resource itself, the catalog, where you can look and see, I think this is slide 17. Gives you an idea of what we fund, who we fund, and you can really look up location and exposure of interest, as well as outcome of interest. And we really hope to get this online where you can query it by entering other terms and getting really deep into the data on linked studies as well. Next slide, which is next steps in advancing children's health. So what we're here to do at NIHS is really to promote the use of cheer to help add environment to children's health studies, as well as implement that exposome concept of looking at biological response. We're enhancing the inventory of existing birth cohorts so that we can add additional detail and link grants. We've created what's now on a funding opportunity, a program to maintain environmental health cohorts, as well as require the sharing of that data externally. And then we're really taking an active role in supporting of a new effort at NIH called ECHO, Environmental Exposures and Children's Health Outcomes, and that'll be another talk later. And then really we need to focus on sustaining our environmental public health communication with our stakeholders and provide support for community outreach. Next slide. We all know that community outreach and engagement is essential. It's in addition to understanding how these exposures affect children's health. They also work to inform the general public of environmental hazards, and we reach out to the community to explain how certain chemicals can affect child growth and development. Next slide. So I just wanted everybody to know about our this is slide 20, Partnerships for Environmental Population Health. This is a way that we can provide multiple ways for researchers and community members to obtain support and innovative creative activities within our network. Next slide. We have communication strategies. We have a resource center, which has materials, and users who come to look at our materials can search through these materials and find pamphlets as well as and tools to use for their research studies. We have a monthly newsletter. We have more than 26 released podcasts. We have monthly webinars, as well as highlight grantees in our news and have an active Twitter page. Next slide. And this has multiples. One of the really interesting things that we've done here is have an environmental health podcast. And in episodes, it really highlights the way that the communities are working in partnership with the institutions and looking at health issues to address at a local level. The podcasts are short and sweet. Topics include things like asthma, prenatal exposures, hydraulic fraction, and they're all available on iTunes. You can keep going through to slide 23. Is it showing? We've just found out that we were considered one of the most 45 awesome podcasts for public health. We were ranked at number 4. And Liam O'Fallon should take all the credit for that. He really does an excellent job of outreaching and networking this resource that has been developed. Next slide. And then finally, our Research to Action program. This is the one funding opportunity that's out on the street that we continue to use that really brings together the community members and the environmental health researchers to investigate a health risk that's really important to the community. It requires that community and institution collaboration. It requires action, and then there's an evaluation at the end. Next slide. So what I have to say here is that prevention is key, that we need to educate ourselves and others about the major concerns of our children: air pollution, pesticides, metals. We have to ask the parents and their families about their exposures. And we know that we need to encourage healthy diet and weight and stress management for families and children, and that we need to counsel our parents and our parents-to-be to avoid and reduce relevant environmental exposures. And last slide, please. And I welcome anyone who can attend. We will have some live streaming of this event, the Environmental Health Science Festival, to kind of end the celebration of our 50th year at NIHS. It's December 6th through the 8th. So if you can, take a look at our website. There's going to be films. We're going to have some sensor development. It's really an exchange of the science between the communities, the stakeholders, and the scientists. And we hope you can join us in the celebration. And thanks again. And thanks for all. Sorry about all the technical difficulties, and I wish I could be there.